I appreciate the opportunity to present on the inverse association of malaria infection with Burkitt lymphoma and the EMBLEM study, role of anti-malarial treatment. Malaria and Burkitt lymphoma are co-endemic in Africa, but malaria susceptibility of children with Burkitt lymphoma is unknown. Prior studies show an inverse association of Burkitt lymphoma with malaria infection, suggesting that these children have malaria immunity. However, the assumption that cases receive treatment before admission prevents firm conclusions. A similar finding using a large set of cases and controls and controlling for relevant confounders also observed an inverse association of Burkitt lymphoma with malaria infection. Despite the consistency of results, concerns in these results remained about the possibility of residual confounding. Therefore, in the current analysis, we sought to assess if the inverse association between malaria infection and EBO remained after a more comprehensive adjustment for confounding. Using data from the Burkitt lymphoma EMBLEM study, which was conducted in 3 East African countries, as shown on the map to the left, with red crosses indicating the sites from which cases and controls were enrolled and the numbers indicated on the map. We sought to construct confounding variables using exploratory factor analysis of questionnaire data and to demonstrate internal consistency of latent factors identified. Domains interrogated by questionnaire included children's pre-enrollment lifetime history of malaria and socio-demographic descriptors. Exploratory factor analysis was considered suitable because it reduces complex information into a few informative factors, which can be used to adjust for residual confounding without overfitting. The 6 extracted factors were named based on the variables that loaded onto them. Inpatient, outpatient, non-specific fever factors were considered surrogates of pre-enrollment anti-malarial treatment. The heat map here shows the correlation between the questionnaire variables as shown in the rows for the 7 domains shown in boldface and the correlation with the 6 extracted factors as shown in the columns beginning with SES. And this data is shown by country with the countries labeled on the x-axis, beginning with A, showing data for Uganda. And the heat map is color-coded according to the intensity and the direction of the correlation between questionnaire variables and the factors. In this analysis, we observed that 42% of children recruited tested positive for malaria infection. Of these, 12% had a recent falciparum malaria infection, which was considered as being positive only on the RDT test, and about 30% had a current infection, which we defined as being microscopy positive with or without a positive RDT result. Lower infection was observed in cases compared to controls, and this was significant. In multivariate analysis, adjusting for age group, sex, study region, and the 6 extracted factors, we observed an inverse association between malaria infection and Burkitt lymphoma. Further adjustment for mean platelet count, hemoglobin levels, and white blood cell count also showed an inverse association. Further, this inverse association persisted when we stratified by age, as shown in the table. And when we looked at the recency of infection, the inverse association was consistent for both recent and current malaria infection. Therefore, we conclude that there is a strong significant inverse association between malaria infection and Burkitt lymphoma, which is consistent and persisted in adjusted and age stratified models. Robustness of the inverse association suggests that it is not compounded by socio-demographic factors or pre-enrollment anti-malarial treatment. We hypothesize that EPL is associated with immunity to malaria, which starts before and continues after disease onset. If confirmed, this hypothesis would explain why individuals who develop Burkitt lymphoma report fewer malaria symptoms prior to admission, and why children with Burkitt lymphoma have a lower parasite load at the time of admission compared to controls. I'd like to acknowledge the contribution of collaborators and co-authors from the following sites. Thank you.